Transcranial Magnetic Stimulation, or TMS, is an extremely powerful tool that can be used along with healthy life choices to achieve a better sense of well-being by alleviating depression symptoms and other debilitating mental health issues. It's been studied since the 1980s, and using it as a treatment for depression has been FDA approved since 2008. It's also used in the treatment of anxiety, pain, PTSD, tinnitus, smoking cessation, and other problems. Unlike systemic medication used to influence cell function, TMS stimulates nerve cells directly. The nerve pathways and areas of the brain related to mood control are often underactive in depression. TMS is used to stimulate pathways connected to the mood centers of the brain with magnetic pulses similar to an MRI. Different areas of the brain are targeted for different purposes, but very frequently the left dorsolateral prefrontal cortex is targeted when treating depression. This region has circuits and pathways which help control deeper emotional centers in the brain. There's not a clear consensus as to why it's effective, but what we do know is that when an area of the brain is stimulated by these magnetic waves, it increases neural activity in that region. This can create new neurotransmitters and, through repeated sessions, have long-term effects, increasing connectivity in the brain and strengthening those circuits that keep us feeling better. According to a study cited by Harvard Medical School of people who did not respond well to antidepressant medications, 50 to 60% did experience a clinically meaningful response with TMS. About 1/3 of those patients experienced a full remission of their depression. And even among patients who didn't experience full remission, their depression was often alleviated for over a year. Here's how a treatment session of transcranial magnetic stimulation works. Using a series of measurements, the area of your brain that is to be stimulated is located. Next, the strength of the magnetic field is adjusted. This is done by targeting the area of the brain responsible for movement in order to determine how sensitive to the magnetic pulses you are. By watching for the amount of power needed to get a twitch of your thumb, the technician is able to adjust the level of stimulation to a level that's right for you. Once the magnetic pulse strength is adjusted, you'll be asked to lay on your back in a chair while the wand containing the electromagnetic coil is placed over the area of the brain that's associated with the particular condition being treated. The treatment itself lasts around 30 minutes, and the wand may be moved in order to stimulate multiple areas during the treatment. You will feel a gentle tapping sensation on the targeted areas that most patients find totally painless. In rare cases, the patient may feel minor irritation at the treatment site. This normally fades quickly. If any irritation persists, it can be managed with over-the-counter medication and typically goes away after the first week of treatment. Most patients will start to notice results after 3 to 4 weeks of treatment or 15 to 20 sessions of TMS. Depending on your symptoms and how you respond to treatments, you may see results much sooner. The use of TMS to treat certain conditions is still considered investigational, so it may not be covered by your insurance. Interested in transcranial magnetic stimulation? Follow the link below to schedule a consultation through Northwest Psychiatry and TMS.